Well, we're with Laura Adams, the CEO of Rhode Island Quality Institute, which operates the state of Rhode Island's health information exchange called Current Care. Laura, I really appreciate your taking the time to be with us today. The Current Care has a very interesting history, dating all the way back to 2001, and if you could just explain that to us, maybe the role you played in getting SureScripts launched briefly, and walk us through today, that would be great.
Certainly. We started in 2001 as a public-private partnership. We're a 501 not-for-profit freestanding entity, not a state agency, but deeply engaged with our state as a partner in all of this. Our goal was to dramatically improve quality, safety, and value. We started out as a consortium of leaders, basically people with their hands on the levers of Rhode Island's healthcare system. And our first question was, well, great, we're all in a room, we're all agreeing to collaborate, what do we do? We settled on information technology. My background is quality improvement, and I knew that I was stymied at every turn because of the paper-based system, that if we were really going to improve quality, we had to go for health information technology. So we became the place where SureScripts decided that they would do their first beta test of end-to-end true electronic prescribing. That pilot ended up being an incredible success, and obviously SureScripts is nationwide now and robust, and we're very proud of that opportunity to participate in that. From that point on, we received the state on our behalf, the state government received a grant from the Agency for Healthcare Research and Quality called the State and Regional Demonstrations and Health Information Exchange. That came in 2004 and kicked off the funding for our privacy framework, our governance framework, and our stakeholder engagement piece of this. Along came high tech in 2009. Our organization was the only one to hit the trifecta to win all three major high-tech grants. That was the Beacon, the HIE, and the Regional Extension Center. We were able to land about $27 million in 90 days to build out everything that we've done so far. So that's sort of the history of how it all came about.
Now, one of the reasons I'm here is because you're such an innovative and extensive user of Direct. So how did that come about?
We are a big believer in a centralized model in that we want, and I think what model you choose depends on what you're looking to do in the future, what your goals are. For ours, we wanted a very robust, persistent database where we could do research, we could do quality improvement, population health, comparative public reporting, lots of things with that. But we sat there looking at in 2004, we did a little survey. There were 60 plus different EHR platforms in our state. And we said, what are we going to integrate with all 60 of these? And there's going to be 70, and there's going to be 80, and then we have to keep every interface up and running. The cost of that was beyond our reach, and the time frame for doing that was beyond our comprehension. We want to move fast here. So suddenly we were at a national meeting when Direct was announced, and then our Chief Operating Officer, Gary Christensen, turned to me and said, point to point. He said, what if one of those points is an EHR and the other point is our HIE, Current Care? Couldn't we use that to lift a continuity of care document out of those EHRs? No interface required, no upkeep required, no millions of dollars to get our community connected. We were astonished at the simplicity of that solution, and it has worked for us. So we have platforms embed a line of code. When a physician closes a record or there's some other trigger that they've put into their platform, we close the record, it sends out an automatic API call up to it, direct message is formed, it attaches the current continuity of care document, ships it up to Current Care. So it's all automated behind the scenes. No physician ever has to push a button to remember to do something. It's automated. So for us, Direct was, we were incredibly excited about it.
So I want the students to focus on what Laura just said. I've talked repeatedly about the need to integrate Direct into workflow, and you've just heard an example of that.
That's right. That's right.